Good morning. My name is William Bell, and I am the president and CEO of Casey Family Programs. Casey Family Programs has been around for more than 54 years, and our focus as an organization is on providing, improving, and ultimately preventing the need for foster care. At Casey, we believe in the intrinsic dignity and value of every person. We strive for fairness and justice in the way that people, including our staff and communities, are treated and the opportunities that they have to succeed by addressing racism, inequitable treatment, and other barriers to inclusion. Today, I'd like to express Casey's gratitude to our partnership that we have with the Congressional Black Caucus Foundation. We are also appreciative of your leadership, your engagement, and your efforts to address critical issues affecting communities across this country. Our session today is entitled Child Welfare: What Communities Can Do to Build Hope and End Systemic Racism and Inequitable Treatment of Children and Families of Color. As a nation, we must create a world where our children's lives are no longer cut short by America's history of systemic racism and inequitable treatment. Our panel today will discuss the inequities and challenges our children and families of color experience in our child welfare system and identify how we can engage communities in critical conversations to identify sustainable solutions. I am pleased to be joined today by three esteemed colleagues in this work. People who I have worked with and have known for years, and who I know that their heart and their history have all been centered around how do we make this world a better place for our children, for their families, and for the communities where they live. We're joined by Dr. Sharon McDaniel, the Honorable Ernestine Gray, and BJ Walker, who has been a leader in multiple states as commissioner and head of child welfare, and who has also been a very successful consultant in helping jurisdictions and other places to do a better job with our children. And so I will ask each of our panelists to introduce themselves before we get into our series of questions and discussion. But why don't we ask Judge Gray to start, and then I'll come back to BJ and then Sharon.
Thank you, William. I'm Ernestine Gray. I'm a juvenile court judge in New Orleans, Louisiana. I have been on the bench since November of 1984. And since 1999, I have been almost exclusively handling cases involving children in the child welfare system, and have been active both at the national level, at the National Council of Juvenile and Family Court Judges as the president, and at CASA as the president of their board. And so I have been in this work for a long time, and I'm looking forward to this discussion.
Good morning. It's funny, I have sweaty palms. I've spent 40 years working in child and family serving systems, and today I know we have an important conversation. And I think the most important thing I can say about my work is I come to this work from an experiential base. I grew up in challenged communities. I've been a foster parent. I've been an adoptive parent. I've been a biological parent. I'm a grandmother. And I have been a leader. I resonate with the people who do the work every day. This topic is extremely important because our children want our families to be strong enough to raise them.
Good morning, Dr. Bell. Good morning, BJ and Judge Gray. It is indeed an honor to be here with you this morning. I'm Sharon McDaniel, President and CEO of the Second Chance Incorporated, which is a kinship foster care agency in Pennsylvania. Additionally, I have the wonderful opportunity to be a board member of Casey Family Programs. And so I'm glad to be here, and I look forward to the conversation.
Thank you all. And so with that, I'd like for us to engage in a conversation about what's happening with our children, especially our children of color, and especially for our Black children in certain zip codes and communities around this country. What's happening with them from the perspective of child welfare, child and family well-being, and what can we do differently to change their futures. And so I'd like to start with a question that really, I think, should be the beginning of all of our decision-making, the beginning of all of our considerations for change, and that is a question about data. And so I'd like to start with just a broad question. What does the data tell us about how our child welfare system impacts Black families? A very broad question because I have a very broad-based panel. And why don't we start with BJ, then Judge Gray, then Dr. McDaniel.
This is a critical question because in this nation, we tend to forget that when you see people who are living in underserved neighborhoods, who are living in poverty, who are living in places where schools don't work, where systems don't serve well, we tend to see those people through the lens of their environment and their context. And so they get defined by that. And so when a system like child welfare, which is intending to be redemptive and to be protective, sees these parents, sees these families, it sees them through the lens of their circumstances. And as a result, you don't really see the parents and the family's real struggle. You just see the consequences of that struggle. But the system is intended not to deal effectively. It's not dealing effectively enough with what that struggle has netted that family and with the conditions that brought that family to that struggle in the first place. I think that's the most important thing we can understand about data. So we have to look at the data across multiple systems. We have to look at the public health data, the education data, the employment data, because only that will help us contextualize the struggle these families are enduring.
Thank you. Judge Gray?
I think what the data also shows us is that the child welfare system does not deal with these families in a very positive way. Many children are removed from their families and are not reconnected, they're not reunited, and therefore they end up growing up in the foster care system, disconnected from their families, aging out of foster care. And we know that according to the data, those young people who age out of the foster care system are behind the 8 ball in terms of many, many things. They don't graduate from high school, they don't go on to college, they have issues with housing, incarceration, mental health issues. And so when I look at the data and I look at the outcomes, what I'm looking for is whether or not we are actually making their lives better. And unfortunately, for many of these young people, African-American children, we are not. And so I think that is our challenge. How do we make it better for them?
Thank you, Judge Gray. Dr. McDaniel.
And I think that that's absolutely right. When we talk about inadequate parental engagement and poor outcomes for African-American children, we got to think about the fact that there are approximately 424,000 children in America's foster care system. And of that number, less than 30% are living with their family members. And so we know that relatives are able and ready to come to the table, but we have to look at why does the data suggest one thing, that we know that families are available, but yet young people cannot have the opportunity to live with those families. So when we think about less than 30% of all of the children in out-of-home care or with relatives, I think we have to begin to lead with the data, lead with understanding what our jurisdictions and what our systems are showing us.
Thank you, Sharon. So, you know, as you've each talked about broadly what the data is telling us, I'd like to, with the next couple of questions, drill down a little further in looking at how that data actually emerges. And so the data speaks to us about who's in the system. It speaks to us about how different groups are impacted by the system. But the data also speaks to us about what the system, and we say system when actually we're talking about the agency. And we often say child welfare system when we're talking about a child welfare agency, which is a government agency that has been vested with responsibilities that are embedded in law. And so right now, I want to make sure that that in this question, and the next two questions, that we're actually talking with a reference towards that agency and how it is functioning. And again, when I say that agency, there are 50 states, there are multiple territories. Within some states, counties run their own agency. And so I also want to be clear to the listening audience that we're not talking about one single agency. We're talking about many agencies with many different leaders, with many different perspectives in many different locales in this country. But when we look at what society says that it values, society says that it values the safety of our children. And by law, we've given state and local governments the responsibility for ensuring that safety. And that responsibility includes the authority to investigate child abuse and neglect allegations. It also includes the authority to place children in foster care if that local government agency determines that that is necessary and if that is sanctioned by courts. And so there's a combination of voices that need to come into play. But the question that I would ask you is, what are your thoughts about how effectively the current child welfare system or child welfare agencies are protecting children, and especially children of color? Because we need to draw a distinction between the actions that we take in the name of safety and the actual outcome of safety, which is what we say we value as a society. And so why don't we start with Judge Gray on that, and then go to Dr. McDaniel, and then to BJ. But the question in general is, what are your thoughts about how effectively the current approaches that we are using, and I think that's a better way of talking about it, how effective do you think those approaches are in ensuring that children are actually safe?
So I think when we talk about safety, we have to look at multiple levels. And I think all too often when we talk about safety, people immediately go to physical and then emotional. But there is safety that is connected to and provided by being connected to those people who you love and who love you in that family grouping. And so when I talk to people about safety, I want to know what are we assuring to the young people when I'm being asked to remove them from the custody of their parents? How are we ensuring their safety to have connections to their family and not just their parents, their siblings, their grandparents, their aunts and uncles? You know, children get hurt in foster care. There's no way around that. I'm not sure that necessarily those are high numbers, but foster care has its issues as well. And so just because we place a child in foster care doesn't necessarily mean that they're going to be safe. In my time on the bench, I've had children die in foster care. I've had children be severely burned in foster care. And so it is not automatic that just because we place them in foster care, they're going to be safe. And we shouldn't rest on our laurels thinking that's true. We have to, really make sure that happens. And so I think that there is still work to be done around that, making sure that foster parents and all those who are connected with children get adequate training and understand the dynamics of the children who they're being asked to be cared for. And so I think there's a lot of work that we need to do in that area as well.
Judge Gray. Dr. McDaniel.
Yes, I was thinking about looking historically since 1619 in terms of looking at Black children. They've been kidnapped, beaten, abused, stolen, sold. And I would offer that if we advance that forward, when we look at the Mary Ellen Wilson case, the first case of child abuse, the system was not created for Black children. And in fact, when Black children had to come to the attention of the authorities, they were often placed in horrible conditions. So they were placed in what would be akin to a prison today, or a horrible group home. So when we look forward, we look now at Black and brown families are overly surveilled. So the surveillance that we see in systems, we know then that those families are overly surveilled. So we're not necessarily paying attention to those children that might need the services, the intervention of child welfare. So the system is overwhelmed because we're paying attention to the wrong thing based on bias and racism. And therefore, the children that are most in need of intervention are often missed. So I would suggest that the system is not paying attention as they should because of the current construct. The current construct does not allow them. It's around safety. What does safety mean, as Judge Gray was talking about? So even when we think about how young people are removed, we are taking the fundamental right of parents away. That child no longer feels safe by anyone because their parents was unable to keep them safe during that opportunity that they had to prevent removal. So I think that the system is failing and we need to recalibrate.
Thank you, Dr. McDaniel. Go ahead, BJ.
To weigh in on that, I think the most important thing we can do right now as we try to think about the future of this system or the future of the agencies that operate within the child welfare system is we have to define safety and protection in a way that resonates to the child, that resonates to the community, that breaks out of a narrow policing and surveillance model, which is what we have right now. And so what that model does, it fails on all ends. First of all, we wait too long to help somebody. In order for the child to get abused and neglected is when we step in. Well, I don't see safety and protection happening in that scenario. And then when we do remove, sometimes just for risk or just because we're so overwhelmed as a system with children and families in need, then when the children get inside, they get lost. That's not safe and that's not protection. And then we don't have the right things to help adults restore their parenting capacities. A lot of parents have, they don't have the skills, but they have the will, but we don't have those fixes. So I kind of question our use of the terms in our current paradigm of safety and protection, because we're not using those inside of the system, inside how the agency operates, and yet we purport to be doing that on behalf of children. We need to redefine our terms, and we need to restructure our business model and our partnerships in a way where true safety and true protection happen. And I'm just going to say this, and in some neighborhoods, that's bigger, most neighborhoods that are underserved, that's bigger than child welfare. We've got to call on our government systems to step up and be in partnership around this, because otherwise we fall back on this paradigm where we remove children because we have doubts about their so-called safety and protection.
Thank you all three for that rather comprehensive response to that question, because I think all of your answers actually connect and overlap in what you're saying. And so in this next question, I really want to build off of your answers here, because, you know, this notion of having an approach to surveillance, sometimes modeled after our police interventions, an approach that says to certain communities and certain members of certain communities that you are a suspect even at the first interaction, as opposed to the term that we use, child safety and family well-being. Those are more nurturing oriented terms, but if the approach and an engagement is centered around a surveillance model, finding a guilty person model, then I absolutely agree with what you're saying, in that there needs to be some redefinition of terms that we're looking at, but also there needs to be some restructuring of the models, the business model, as you were saying, BJ, and as I know that both Judge Gray and Sharon have demonstrated, not only, you know, just talking about it, but where we're living now, in our current day, there's a lot of conversation happening because people are rising up across this country saying, I am not willing to continue to be subjected to policing the way that it has been done to me and my family and my neighborhoods and my communities for decades. And when we think about the child welfare, child protection system that we're operating with now, it is one that has been around for many, many decades. And while there were certain approaches to it going back to Mary Ellen and evolving forward, the structure that we currently have kind of has some of its birthplace in the early 60s, even before the discovery of the battered child syndrome. So if we're removing children for child abuse and neglect, before child abuse and neglect was actually termed or discovered as a syndrome, what are we really doing? And so as we are now dealing with the voices of people reacting to the historical aspects of policing, what do you think we would hear if we had parents who have been subjects of this child welfare system and we asked them to raise their voices about how they believe they have been treated and what they would call on the child welfare system to do differently to ensure their human dignity as parents of children who care as much about raising their children safely and healthy as the government suggests that it does, but oftentimes parents are not given that opportunity when they come in contact with this system. And so I'd ask you to think about the parents that you've interacted with. And I know you can't speak for every parent, you can't speak about what happens in every system, but if parents were talking to us now about what they think about how they have been surveilled and policed through a child welfare system, what do you think they would tell us about how this system is functioning? And why don't we start with Dr. McDaniel and then go to BJ and then to Judge Gray.
William, that's an excellent question. And I think too often parents, their voices are silent. So thank you for elevating the voice of parents through us. And I would just offer that the birth parents that I've worked with that have engaged in the system, and I was the child protective services worker. So back in the 80s, I remember that system that you're talking about, and I pushed against the system back then. But families would talk about being pathologized. They would talk about being dehumanized. They would talk about being victimized by the current construct of the system, because the system is, it's looking primarily at the safety of the child. And we talked about what does safety really mean. And we pathologize families to suggest that something is wrong. If you're Black, brown, or poor, something is wrong with you. And the system suggests that we have to do something to fix you. So parents they don't need to be fixed. What they need to do is to be nurtured. They need to, the system needs to understand that every family has a crisis every now and again. But what I would find out, it was who would get to the crisis first would determine what happened to the child. So I would suggest to you that families, I am sure that there are some families that feel like they are supported, and it depends on the worker as well. So when we think about child welfare, and we think about, we put the least experienced workers making lifelong decisions for families on the front line. We have to retool and rethink about how we're even structuring who's making the decisions about removal, when in fact it's usually a 22-year-old. I was a 23-year-old making life-altering decisions for families, had no child, not married, but I was making decisions because I was an alumni of CARE. I could come with that compassion, that empathy. And that's what's missing currently with some systems, not all, but certainly some systems.
Thank you, Sharon. BJ.
So the funniest thing happened once when I met a woman who ran one of our parent councils. Very articulate woman, very knowledgeable about the issues that we're facing families, really talking to us about policy and practice. And then I found out her kid's been in care for 8 years and she don't have them back yet. And I said, wait a minute, and I say, whoa, wait. How can she be doing this work, having this conversation, and we haven't figured out how to get her kids back home yet. And so I use that story to say it's frustrating because the system is so layered with so many different intricacies, so many different masters and voices and mandates and policies and decision makers. And what happens is as a parent, even one who's being has pretty good agency around the situation gets lost in the shuffle, and the kids get lost in the shuffle. So I think if we are bringing parent voice right to the heart of solving what's wrong with child welfare, we've got to understand that difference I talked about before between skill and will. So when she started describing to me why her kids weren't back, it was an issue of she wasn't consistently displaying a certain skill. Of course, it's hard to do that when your kids are not at home with you because all you're doing is displaying it in a foreign situation. But we've got to help bring a sense that people will do what they know how to do if you help them learn to do it well. And the system doesn't own that right now. And so you get multiple voices, and the caseworkers struggling with policies and layers of mandates, and the parent is trying to do things, and the services you asking them to go to don't even exist in their neighborhood. And we set them up for failure. And so we've got to bring that voice back to the center and understand that as a system, if you're going to have the audacity to take somebody's kids, you ought to have the audacity to take up responsibility for helping them develop the skills to get their kids back.
Mm-hmm.
Thank you, BJ. Judge Gray?
Well, thank you, BJ, for that, because that's how I run my courtroom. I do think that if we ask parents how they feel about the system, I think they would liken it to just like the police department in terms of the social workers. They feel like they're under the microscope. They feel like that they cannot do anything right. They feel like they're not valued as human beings, that their opinions don't matter, that people assume that they don't love their children, which is not true. I was in a session not too long ago, and a stakeholder said that for many of the people who are involved in the system, they believe that neglect, the word that we use, is just a cover up for a poor. So it gives them a license to deal with people who are poor. And many of the parents say they don't think they would be in the system if they were not poor. And I think that it's important to really talk about in this context the court's role in sort of being at the front and making sure that everybody is doing what they are supposed to do, including the judge. But Sharon talked about the 23-year-old worker. And for me, the judge is at the forefront of when the worker says, because in my jurisdiction, the worker has to say to a judge, I believe the situation warrants us placing this child in foster care. The judge has to know and understand the law, him or herself, and say to the 23-year-old, well, I understand you're making that recommendation, but here's why I'm not going to do that. And you need to go back and do this work before you come to me and ask me to do that. The stakes are far too high, and I'm not going to do it based on these facts that you're relaying to me. If you bring me something else that shows that there is a critical need, then I'll go, but now I can't. And I think that judges really have to be willing to stand up and be on the forefront and say, not today, you're not getting it today, go do some more work. And that's what the law requires, doing the work on the front end. You try to prevent removal. You don't remove and then try to reunite. We try to prevent removal first, right? And so that's what I think we need to be requiring people to do, to figure out how to get prevention in the front end and try to prevent removal before we're taking kids from their families. And I would also say, in addition to the voices of the parents, we need to have the voices of the young adults as well, because their experience is going to be different from the parents.
Thank you all, and I absolutely agree with those responses. And when you take time to step back and think about what this system is charged with doing, what the agencies are charged with doing, it's about intervening in other people's lives. It's about passing judgments on what other people are doing, but sometimes that goes into passing judgment on whether or not other people care about their children. And that I don't think is embedded in the law. That becomes how human beings are responding to situations that are in front of them. And so we've talked about data, we've talked about what society says it values. We've talked about our experiences with how families, parents might respond. And at the end of the day, what we should be about is how do we make sure that every parent has the opportunity to actually raise their children and have the help that they need in order to do that. And so the final two questions that I would want to pose to you is one is around, so what do we do to bring about change? Because we know that there are many aspects of the existing system that just simply need to be done away with and be replaced by something that is more adept at uplifting the human dignity of families that may be going through something. As you said, Sharon, all families go through something at some point in their lives. We shouldn't treat some families who go through something differently than we treat other families who go through the same thing. And so this next question I would ask each of you is, so what are the 2 or 3 things that you would say we need to do? We now meaning the government, meaning the community, meaning philanthropy, meaning families and communities. What do we need to do to bring about the change that is necessary to move this system to a place where it is actually doing what families and children need it to do? And I'll start with BJ, then Judge Gray, and then Dr. McDaniel, because it shouldn't matter what zip code I live in or what community my case was called in from. The treatment of me and my children should still be the same. So what are 2 or 3 things that we need to do, or one thing that you feel very strongly about that we need to do? Because I do have one final follow-up question that I'd like for us to be able to get to this morning. BJ.
I'm going to say a few things quickly. One, child welfare operates in a flawed narrative, public narrative. Someone needs to invest in changing the narrative so that leaders don't wake up and caseworkers don't wake up every day living inside a narrative that has them be the police rather than those who restore. That's number one. Number two, we have to set up our government systems in a way where family well-being becomes the substitute for child welfare, because no child's welfare is good outside of family, whether that's a new family, a foster family, or the family you were born into. All these families need strengthening, and they just need different levels of it. But the way in which our federal safety net and our programs and services come, number one, they come in silos. They hit the ground in silos. By the time a dollar hits the ground, it's 35 cents. And by the time 35 cents hits the ground, it doesn't hit in the neighborhoods who most need the resources to hit them. So the narrative needs to change, and the way in which the resources come to the ground needs to change. And then the front door to the system needs to change. If I could make one change in child welfare, I would completely blow up the current front door and I would redesign it. Because if it continues to operate as it operates right now, it will see families through the lens that it was built with. And so if you live in a poor neighborhood, you live in an underserved community, you have your child or a family of color, you're going to be seen through the current lens. So I'd blow it up and redesign it so that I could differentiate between kids who really need another option, and there's very few of those, and kids for whom I can help restore the option they were born into.
Thank you, BJ. Judge Gray.
So thank you, BJ. I don't know that there's much I can say in addition to that, but I think there are a couple of points I would make. I have always talked about the need to have prevention be all the way at the front door. And I think some of what BJ says, it relates to that as well. I think a part of the system that doesn't work is this mandated reporter, again, because we're reporting after the incident has happened, after the child has been harmed, if we think that is what is happening. So a system that relies on waiting until something bad has happened and then try to address it is not going to work, because the trauma, for example, has already been exhibited on the child, and there's no way to erase that. They're going to live with that the rest of their lives. And so our challenge is to figure out how do we support families in a way that we don't have these incidents occurring. And so I would just lift up, for example, the Casey's Communities of Hope. In Louisiana, we are doing some things that's called My Community Cares, where we're going into the neighborhoods right down to the very zip code where there are high reporting numbers, and working with the citizens in those communities to say, what is it that you need in order for you to raise your children successfully in your community, keep them engaged in the family. So I think that respecting all families and making the resources available in the community, in the local zip code, and that includes all the resources, education, mental health treatment, substance use treatment, all of those things that people need to have. And because they're poor, many of them can't get across town to get them. And so the resources need to be in their communities, not across town, but available, and available not 9 to 5, which is one of the things I've always talked about. Families have crises, not 9 to 5, 2 or 3 in the morning, and then they have to wait until the office opens or some office opens in order to get help. So we have to figure out how to, as BJ said, blow up the system and do it differently so that it really meets the needs that the families have.
Thank you, Judge Gray. Dr. McDaniel.
So, William, I think BJ and Judge Gray hit the nail on the head. And I think at the end of the day, it's about reinvestment in families and communities. We cannot value foster care and out-of-home care more than family strengthening and family care. And so moving upstream to ensure that that happens at the end of the day, I think we'll get to what BJ and Judge Gray was talking about.
Thank you. Thank you very much. You know, this has been a wonderful conversation. And in closing this conversation, though, I would really like to, rather than use my time to do a summation, I would really like to have each of you have the final word. And the final word for me is simply this. If the listening audience takes nothing else from this morning, from this conversation, what's the one thing you want to make sure they walk away with from this perspective of how what we currently call child welfare and child protection is treating our children and families and communities, particularly Black children, families in their communities, and what do we need to do to make it better? What do we need to do to dismantle and reconstruct something that meets the needs of our children and families? And I'll ask each of you to take a minute or less to respond. And I'll begin with Dr. McDaniel, followed by BJ, and then Judge Gray.
Thank you, William. This has been a wonderful session. And so James Baldwin said, not everything that is faced can be changed, but nothing can be changed until it is faced. And I think that we really have to be bold and courageous in this moment. We have to be able to bring the 5 sectors together to be able to say everyone has a role to improve community, because if you have healthy communities, you'll have healthy families. We also have to have a system that's willing to unlearn, to undo, so that they can really support families and children the way in which they were intended. And so as we move forward, let's create a way in which we can dismantle so that we can create a better child well-being system. Thanks, William. And thanks, Judge Gray and BJ.
Thank you, Sharon. BJ.
Thanks, William, for the opportunity to be here and to be in the presence of Sharon and Judge Gray for this conversation. I think the only thing I would add is I think we undervalue in child welfare practice today and in child welfare, the way we do child welfare, how complicated the lives of the adults who wind up in the vantage point of the line of sight of these systems. And not just child welfare, I've run human service systems. People have complicated lives, and we tend to dismiss those complicated lives with simplistic ways of dealing with children and families and their circumstances. And somehow we have to put in place leadership, funding, resources, narrative, all of it needs to be aligned the same way. If you ask me, what should philanthropy do and is it different than what local government should do? No, we need an aligned line of sight on what is going on with parents and children who are living complicated lives because our society has not offered sufficient opportunity for them to have what we know are the basics of having a good, stable family life. And so I know that doesn't feel very specific, but without good values, we can't erect good systems. And so that's what I ask for, us to really have a down-to-earth value conversation in this country about what we have as an expectation for ourselves and open that expectation up through the systems that we construct in order to help people who are struggling. Thank you.
Thank you. Thank you, BJ. And Judge Gray.
So I'm often reminded about this thing that I heard, I don't know where, but it says children are our greatest natural resource. And I quite often criticize our systems by saying that that is something that we say that we truly don't believe in it if we did, because if we did, we would behave differently. And so I hope that people listening to this session will leave understanding that the young people and families that interact with the child welfare system, the child welfare agency, and the courts are people too. They are human beings, and they deserve to be treated the way you would want to be treated if, heaven forbid, you or any one of your families found themselves in a situation. And I'm convinced that most of the people who see the work that we do, who understand what we do, would not want what happens to poor African-American families happen to their families. And so leaving with different values, I think BJ talked about having different values. I think that is important. And the value that I think we all have to put our heads around is the one where we believe in the intrinsic value of people and the intrinsic value of families and the importance of families in the children's lives.
I want to say thank you to each one of you. And it is an extreme honor to have served alongside of each one of you over the years as we continue to try and bring sustainable change and bring hope to children and families across this country. Thank you all for joining this panel this morning, and continue your work and continue your efforts to build hope for all of our children across this country. Thank you.